Hi, Dr. Anne Sylvestre here. I have a case I want to share with you. On the weekend, I saw a 22-kilo Shepherdie Cross dog, not sure if it was male or female, young adult that had presented to the local hospital here in Costa Rica after being hit by a car. The dog was non-weight bearing, non-ambulatory, non-weight bearing on the hind limbs and in a lot of pain. By the time I got there, they had given the dog some pain medication, so it was a lot more comfortable, and had already taken radiographs, and that's what I'd like to share with you today. So let's have a look. To orient you on this VD pelvic radiograph, the left femur is on your left, so a bit of an opposite of our standard positioning. The first question that was asked of me is, why is there a hole in the femur, in the left femur? Let's just take a look at the whole X-ray radiograph, and then let's take it apart bit by bit. To me, when I look at this, the left femur is interesting. The right stifle is wonky. I think that would be an appropriate term in this case. So the right stifle appears totally deranged. I see a very visible left ischial fracture, and to me, both acetabulate, although at the very same level, nice and even, look like they are way too close to the sacrum for my liking. So now let's just hone in here and let's start with the pelvis itself, and we'll take a closer look at it. Closer look here, the left ischial fracture is very evident, nice and sharp. One of the things that sometimes I get more concerned about a fracture in this area of the ischium will be, what's the sciatic nerve feeling right now? How is it working? Because the sciatic nerve runs closely to this area in the dog. So that's one thing I'm going to be thinking of on my physical exam, close look at the left sciatic nerve. There appears to be some opacity here around the femoral neck area, proximal metaphysis. I think that's just positioning, and we're looking at greater trochanter overshadowing because this femur is in an odd twisted position. When I look more closely at the left ilium, again, I find that the hip joint, the acetabulum, is way too close to that sacrum, sacroiliac joint. And so when I look more closely, I can see a point here of the left ilium itself, which appears to be, or maybe that's part of the ilial wing, it appears to be just in a wrong position. When I pop over to the right ilium, again, this right hip appears way too close to the sacrum as far as I'm concerned. And so when I look at the ilial area, there just definitely is way more opacity than should be. So I'm thinking, one piece of bone over another, and I might be looking at a point sitting right about here. I find that the lateral view for me is way easier to read when it comes to ilial fractures. So why don't we have a look at that? So on our lateral view, there's this little white arrow there, which is just part of the digital X-ray system itself, and I forgot to take it out of the way before snapping this picture. So I am sorry about that, but let's work beyond that. I can see, if I follow this ilial wing, I can see a sharp edge, so definitely a fracture here. Part of the iliac shaft here is coming to quite a point as well, so another fracture. There's a really sharp piece of bone sitting here. Shouldn't be, right? So I know I do have a couple of bilateral iliac shaft fractures I'm going to deal with. One of the things after looking at this X-ray, I really want to make sure I do a good neurologic exam on this patient. Although sciatic nerve damage is not that common with iliac shaft fractures, they can occur. Let's take a closer look at the right stifle, the deranged stifle. The femur is laying so far caudal to the tibial plateau itself, you know there's got to be some ligament damage here, so we're going to be sure to examine both collaterals and both cruciate ligaments when we have a look at the stifle. Now let's take a look at the left femur, that more distal left femur, the one with the hole in it. If you take a look at the contours of the cortices of the proximal segment of the femur, you can follow them down nicely. What's happened here is that we're looking at a very old, completely healed femoral fracture with some malunion associated with it. So we don't have, a perfectly formed femur. But this is definitely an old fracture. So this dog was probably hit by a car many years ago and healed quite well. I do find that I suspect we probably had a 2-piece long oblique here, and I do find that because of the heavy musculature in the femur, it is not unusual for these to heal, yes, with this malunion appearance, but in a perfectly functional manner. So just an interesting case, and I thought it was worth bringing to everybody's attention. Introduce you to diagnosing collateral ligaments. The idea is you put the joint in a somewhat comfortable extension, and you try to crack that joint open opposite the ligament that you are trying to assess. So if you can actually crack it open, that ligament over here is broken. But if you can't crack it open, well, the ligament is intact. So in this particular video, my left hand is stabilizing the femur, and I've grabbed the tibia, the foot actually, and I am cracking the medial side open, which is where the medial collateral ligament is, and that totally went in the wrong direction. Therefore, the medial is done. When I push down on the tibia and try to crack it open laterally, nothing happens. So my lateral is okay. So medial is gone, checking lateral right now, won't bend inappropriately, so lateral is okay. Still again, stressing my collateral, it's okay. If you want any more information on how to test for lateral or medial collateral ligament on the stifle joint or any other joint, just go to my YouTube channel. There's some free videos there, diagnostic and all sorts of different videos for you to go have a look at. Thanks for being here. Until the next time.